So now I'll talk about a very important subject that we are facing patients with such who diagnosis maybe daily in our daily practice, which called acute coronary syndrome. Acute coronary syndrome, it is either unstable angina, non-ST elevation MI, or ST elevation MI, and sometimes sudden cardiac death. It is included in this definition. I'll talk about the clinical presentations of those patients. Usually, typical presentations of patients with acute coronary syndrome, usually they will present with chest pain, left-sided chest pain, or central retrosternal compressing chest pain. The pain also, it may be tight, like, belt-like, and the very important thing also, the radiation of this. It will radiate to the left arm, also it will radiate to the jaw and to the back. This is the typical presentations, and also it can be associated with nausea, sweating, vomiting, dizziness, and fatigue. But what about the atypical presentations of those patients? Not all the patients with acute coronary syndrome will present with chest pain, left-sided, compressing, radiating to left arm. But also they may present with right-sided chest pain, with right shoulder pain. Also, they may present only with lower jaw pain. Also, they will present with epigastric pain or pain around the umbilicus. Sometimes patients with diabetes or elderly patients, they may present without chest pain, but with the symptoms might associated the acute coronary syndrome presentations like dizziness, fatigue, loss of consciousness. These are the atypical presentations of patients with acute coronary syndrome. نقطة مهمة كمان, the atypical presentations عادة we'll see it in the females more than the males.